A month from today, Nigeria would have been battling to get the coronavirus pandemic under control for 1 year. The World Health Organization is projecting that the number of global confirmed cases would hit 100 million by next week. Here in Nigeria, over 120,000 cases have been confirmed, with cases rapidly increasing in the second wave of the pandemic. The Presidential Task Force on COVID-19 and health officials insist that the best preventive measure to curb spread of infection is by abiding to all the safety guidelines, especially wearing of face masks. Joining me in the studio to talk about how the FRSC is ensuring compliance with COVID-19 protocols amongst the motorists and safety of its personnel during enforcement is Lagos State Sector Commander of the Federal Road Safety Commission, Olusegun Ogugbemide. And also joining us to talk about how Nigeria has been able to manage the pandemic over 1 year now, that we will be marking next month, is Jide Ologun, lawyer and social development advocate. Gentlemen, good morning. Thank you for joining us on TVC Breakfast.
You're welcome.
All right, let me quickly begin with you, Jide Ologun, looking at how Nigeria has managed the pandemic when you talk about handling of the pandemic. And one of the things that you hear the PTF, that's the Presidential Task Force on COVID-19, always speak about is the fact that people need to take responsibility. Always harping on that. And it seems that has become one of the most Herculean tasks for people to do. And I wonder what really the challenge is from your point of view.
Exactly, there is expected to be synergy between the government and the governed, but we have not witnessed that extensively in Nigeria. So I think for the government, you also need to evaluate that, have we earned the capital trust required for the citizens to flow along? And that is not to say that citizens should take risk. You have to own your safety and ensure that you stay away from trouble. But then we can advise on some countries of the world that have achieved extensively in combating COVID-19. You talk about Taiwan that takes the lead. Taiwan was quite proactive, and you have a high population of the enlightened in Taiwan, so they cooperated with the government on all the measures taken, and taking advantage of the fact that Taiwan is close to China, so they've seen the impact of the COVID-19, and they went through the early 2000s SARS that broke out then. Then you look at New Zealand. New Zealand also was quite proactive. They came up with facilities to engage COVID-19, and at a point they moved to disease elimination. You talk about Singapore and some other countries, but for us in Nigeria, I think we have benefited more from grace than the practical steps we have taken. And don't forget also that at the point in time, we were faced with a crisis of managing the palliatives, because when the government was expected to support the citizens, it was not up to the expectations of the citizens. So that may be responsible for the lack of cooperation that the government is experiencing now.
And still speaking of cooperation, let's turn to the sector commander now on how the kind of cooperation you've been getting from the PACs, that's motorists, drivers, and the likes. How has it been, especially with them owning their safety, like Jide Ologun has said?
Thank you very much. Prior to the NSAS saga, we were almost at the, let me say, if I want to place it on percentage, 80% receiving 80% cooperation from the members of the union, transport union, the PACs, and even the commuters, as regards their compliance with the COVID-19 protocol. But it's quite unfortunate that where we are now is being a big tug of war, trying to convince people to go back to the achievements we made. Because it's like many of us have thrown caution to the winds. Many don't even believe in the, let me say, the devastating effects of the COVID, the pandemic, and that is what we are really battling with now. So I will say categorically that for where we are now is still trying to convince them, trying to enforce the compliance with the protocol.
What are the challenges your men face while trying to achieve this?
we always believe that 15%, enforcement takes care of only 15% of every problem we want to solve.
Right.
It's sensitization that actually takes the major bulk of getting the problem solved. And if you look at the way we have sensitized the members of the public right from the inception of the activities of the Presidential Task Force, because we were actually fully involved. When you talk of bringing the front burner, FRSC worked assiduously with them to achieve where we were, what we were able to achieve in the first regime. But you now realize that from all what we have been able to achieve from our research, because we have what we call social corporate responsibility aspect of our job, apart from the transport sector involvement, we go to local area, that's getting to the grassroots, to get some information for the Presidential Task Force as regards the compliance level of the people at the locality. We realized that 65% of the people that were assessed were not wearing it at all. 25%, they wore it, but wore it wrongly. Some will just wear and drop it below their jaw, while we just had about 10% compliance. So where would that take us to? And when you look at the population of Nigerians and the population of those that are really complying, you realize that we are not there at all.
That brings me to the next question. We hear the PTF talk about, the use of the face mask, talking about these safety protocols almost on a weekly basis. Are we not doing enough when it comes to enlightenment campaigns to ensure that people understand perhaps how to use the mask and what not to do and what to do, like he pointed out?
You cannot rule out the emotional aspect of communication, So I may be listening to you, but not interested in your message. So, and I think we need to bridge that trust gap. It's very important, you see, and because the citizens will now be comparing Nigeria, for instance, with America, that came up with stimulus for the citizens. That okay, if you have been negatively impacted in the area of paying your rent, we give you some money.
That will make them wear the mask.
As cooperation,
right?
You need to mobilize people. You heard now, in the first regime, they achieved so much. But after the NSAS...
The first phase, you mean?
Exactly. The NSAS regime of the COVID-19. We have the second regime.
That's where we are.
So when, during the NSAS protest, citizens realized, we have these palliatives out there, and we suffered so much during the lockdown, it became difficult to connect with them again. And it's important that you link up with the people you are trying to reach, because in communication, your communication is not complete until you have feedback. So the feedback is that, you people don't care about us.
Right.
And of course, they monitor the report, the amount involved and everything. And I'm quite impressed that our Oga here is embarking on this sensitization. And I can say, the sensitization is going on. The religious leaders are talking about it, community leaders, But, sir, we offer in the Nigerian Institute of Public Relations to collaborate with you in extending. You need to persuade the people.
All right.
You need to buy into them, and so that they can buy into the project. But having said all this, I just want to echo a very strong warning that whether you are impressed by the response from the other side or not, you need
to
life,
own your
so
safety.
You have to take responsibility.
All right, let's come back to the sector commander now. For your people, we know they face these challenges, but how are we ensuring, or how is the FRSC ensuring their safety while carrying out these duties?
I think after the health workers, the law enforcement agencies have to be the next in line when it comes to exposure to the pandemic. And that was what the Corps Marshal, Dr. Baboyo Yemi, realized early enough by making available all the necessary protective equipment that are required to protect the men. We have contacts. Apart from the people, we get the particulars from them.
Right.
And, documents, you wouldn't know the extent to which it has gone. And the first line of effort that was made was to get the sanitizer available. What they have in their patrol car, they have the water and soap, apart from the sanitizer. That's after making effective use of their face mask. Well, The other aspects that actually have been so disturbed is the area where we have to do rescue and the efforts in resuscitating the victims. You remember we need at times in the past, you have to do mouth-to-mouth respiration,
yes.
which you cannot engage in now. So we try to sensitize our staff that don't be too emotional and be too sentimental when it comes to that, because the passion to rescue,
get them carried away.
You understand, because the theme, or let me say the idea is always you should take care of your own safety, personal safety first. Because even the Bible says, love your neighbor as yourself. And an indication that you have to think of your own protection before you can start thinking of others. So don't get carried away. And that's the extent to which we have done. And when we are dealing with members of the public now, we give that distance so that even when he's not wearing his face mask, the first thing you say is, please put on your face mask. So when he insists in not wearing it, we make sure your own is intact. So all the necessary efforts, and on a regular basis, like we've been giving directives to go and reconfirm our status as regards the COVID-19 test, which is a regular routine in FRSC to know those that are affected. We know those that we have to give the opportunity to go in on isolation so that the effect will not spread among the staff.
Now, one key aspect that I'd like for you to touch on is the aspect of licensing, when people need to get their driver's license. We saw what happened during the NIN registration. Yeah. We saw the crowd, and we saw the kind of reaction a lot of Nigerians that generated with regards to that. What measures are being put in place that it is not a similar situation when people perhaps want to renew register for their licenses?
I wouldn't know if it's because we started with the PTF, PTF, or maybe the measure of level of enlightenment in FRSC. We put all these things into consideration right from the commencement of the problem. If you get to our various centers now, you see water and soap, you see sanitizer as you're about to enter, and it's also written there, put on your face mask. And we also have this distance provision where either you are standing or you are sitting. There must be social distance among the applicants. So all are the things that we have on ground to make sure that we don't use our facilities to encourage the spread of this pandemic. And it's still there till tomorrow until God is able to help us.
How are we checking the crowd as well? The number of persons that come in per day?
We have various stages.
Right.
If you are coming in, you have a place where you stay and you are being called in. So even while you are staying, the provision for social distance is also there. So, in the previous arrangements, you just come, all of you will line up when we're not having the problem of pandemic. But now the spacing is there. We have departmental stationing, where if you are just coming, you stay here. We call few numbers of people that we can make provision for capturing, and that's how we regulate it.
All right. Before I get to another issue, which we have touched on earlier, let me quickly get Jide Ologun's perspective to the aspect of testing moving forward, how we can ramp up testing. Seeing that the second wave, we're recording lots of infections and the cases are rising on a daily basis. And so far between February of 2020, when we had the index case, and now we've had just a little over 1 million tests done out of 200 million Nigerians. How do we ramp up testing moving forward?
It's all about upscaling the capacity that we have, and I know right now we have infrastructural challenge, and it's about investing into all this, because these facilities are available for purchase, for importation, and begin to look at what we can locally develop. And I made reference to Taiwan. Taiwan learned from the earlier experience of SARS to develop capacity for future external shocks. Nobody can guarantee that this is the last problem that will hit the world. So we need to build capacity. I mean, if you look at FIRs, the way they have been carrying out the managing of applicants, I mean, I've experienced it. It's just a matter of rising up to the occasion. And it's the same point we are saying. So if you know the population you have in the country, and you know the number of people you want to test on a regular basis, do you divert resources to ensure you install the capacity? And we are still talking about electricity in Nigeria. Do we have the backup? Do we, again, if you look at New Zealand, New Zealand leveraged so much on technology to handle the COVID-19. Have we been able to also achieve that? So it's about building capacity. We've known for years that we are 200 million. You know, this is a global challenge, but if you don't build capacity, you are not likely to handle it well. And that is why I still anchor my position on the fact that God has been so gracious to us, because even in Nigeria, we are not talking of pandemic. We are still dealing with epidemic.
All right.
You know, so we need to put structure in the isolation centers, make it sustainable, not palliative in nature, you know. And if we do that, we can cope.
Quickly, I wanted to ask one question before we go because of want of time. Talking about penalties for those who flout the safety protocols. Are there penalties for that?
Sure.
All right.
The federal government has given the presidential order that we should reduce the capacity of passengers by 50%. So if you carry beyond that capacity, it's overloading. It's recorded as overloading. Right. And also we appreciate the fact that we've been battling with national transit all this way, but with the opening of the border, international transit has coming. That's people coming outside the country. And I've given the mandate to the unit commander, Badagry, who happened to be the gateway to Lagos, that he should put more efforts in making sure that the protocol, the COVID-19 protocol, is really adhered to.
All right. We'll leave the conversation here now, but we must thank you, FRSC Sector Commander in Lagos, Olusegun Ogungbemide, for your time on the program, as well as Jide Ologun, lawyer and social development advocate, for your time as well. Thank you for joining us. All right, let's tell you now that the views and reaction of all our guests are theirs and have no connection with TVC News. That's all on TVC Breakfast this morning.